You're listening to the Sass Says podcast. I'm your host, Christy Rocha, also known as Sass. I identify as a woman, a wife, and a mother. That should tell you a lot already. And over the last few years, I've learned the value of talk therapy. I have seen how my inner work not only enhances my own well-being, but also my marriage, my parenting, my relationships. And in fact, you wouldn't be hearing this right now if it weren't for the work I've done. My mission is to debunk the misconceptions and stigmas around what therapy is and who it's for. Let's normalize working on our mental health and seeking help when needed. We've all heard of self-care, self-help, and self-love, but do you often wonder how to actually make it all happen? I do. You'll hear strategy-based conversations with professionals, as well as inspiring and validating stories from women who are just like you and me. Think of this podcast as the weekly therapy sessions you didn't know you needed, with a dash of sass, a lot of vulnerability, and me, relentlessly asking, but how? All right, so today I am joined by Jenna Overbaugh, licensed professional counselor, certified personal trainer, and mama. Jenna's specialty is in treating OCD and anxiety. And this is just my 2 cents here, but I'm pretty sure it won't be too long before you look up OCD in some dictionary somewhere and see Jenna's name. She knows her stuff. Her focus is on educating her clients and giving them the tools they need to manage their recovery independently. She's also passionate about offering guidance and resources for the world to better understand OCD, particularly in mothers. She is the host of her own podcast called All the Hard Things and is a therapist for No CD, which is an organization she tells us more about on the show. Jenna's passion for helping women and anyone really impacted by OCD is like nothing I've ever seen. She explains to me what OCD really is, how and why it shows up in motherhood, particularly new motherhood, and how OCD is treated in therapy. She shares her personal story of postpartum OCD and her beliefs on what needs to change in postpartum care when it comes to maternal mental health. In my mind, Jenna is the resource on OCD and motherhood, so check her out and I will see you on the other side for my final thoughts. Hey, Jenna, thank you so much for joining me today.
Hey, thank you so much for having me. I'm really excited to dive in and see what we can do here.
Yeah, this topic that we're about to get into, I think I'm in the shoes of quite a few people just not realizing how extensive it is, how out there, and how many people are actually going through what it is that we're going to talk about today. I guess we should probably just start talking about it. But I guess what I'm trying to say is, in learning about you and preparing for this interview, my mind was a little bit blown. So I'm hoping that we can continue to share your message and what you're about and help some people. So why don't we start with, from your perspective, what is OCD?
Yeah, and I believe 100% that by the end of this episode, so many people out there will be like, oh my gosh, do I have that? Or
yeah. That's kind of where I'm at right now. I'm like,
yeah, and like, oh my gosh, that explains me. That explains everything that I've been going through. And that's really the experience that I want to give moms who are in the thick of it. Like, what inspires me so much to do the work that I do is that I was doing this for 10 or 12 years at that time before I really got struck by it. I've always been an anxious kid. Like, that was always definitely part of me. And looking back, I can definitely see some obsessive compulsive tendencies rearing its head, but I never thought anything of it. Loved working with the OCD population. It was just kind of what I navigated towards and focused on professionally and in research. But when I had my son, he's now about 3.5, I had all this information. I had all this education. I thought everything there was to know about OCD. I thought I knew everything there was to know about anxiety, how to treat it in the most, wild of scenarios, residential level experience under my belt, some of the most debilitating cases in the world. And I was trusted with treating that and training other people on how to treat it. And it still rocked my world. And so I just remember very vividly walking around my house one day, and I remember exactly where I was and thinking, how on earth do moms who don't have the background that I have survive this?
Mhm.
And the sad reality is that some of them don't.
Mm.
But I mean, I even have chills right
Yeah.
now thinking about women out there who don't have the brain that I had as far as like all the education, all the context for these thoughts. Like, oh my God, my heart breaks. It's
Yeah.
breaking right now for them. And that's why I do what I do. And so when we talk about what is OCD, we really are, two things come to mind. It's kind of a two-part problem. So we have obsessions and then we have compulsions. Obsessions are intrusive thoughts, ideas, images, impulses, or feelings. And they're just experienced kind of outside of our quote unquote control. They come in really intrusively, meaning like, where the heck did that come from? Like, I didn't conjure that up. They just kind of pop up. Um, they can be experienced as very disruptive and very distressing. And so, a lot of times, too, what contributes to these obsessions being so difficult is that they're often ego dystonic. So, that means they're inconsistent with our values. And that's why they can
Mm.
be so triggering and so distressing to us because it's like, whoa, that's not consistent with my values. Why did I have that thought? What does that
Mm.
mean about me that I had that thought? So those are the obsessions. And again, they can be thoughts like, what if, what if, what if, what if? Could also be images, just like this random flash of an image that kind of pops up. Could be feelings that we literally physiologically feel, could feel like an urge or even like a command.
Mm.
And then what happens is we all have intrusive thoughts. We've done research to determine that everyone, no matter where you're at in the world, no matter your mental health background, your socioeconomic status, we all experience intrusive thoughts. Again, those kind of bunk neurological junk thoughts that just come in out of our awareness and they pop up and they're just really kind of strange. What makes it different for someone who has OCD is that they can't just have those thoughts and let them come and let them go and easily kind of continue with their day-to-day life.
Mm.
They interpret these thoughts as being somehow significant. So that misinterpretation of those thoughts or of those images being significant leads them to feel a lot of anxiety, a lot of more additional racing thoughts, a lot of catastrophizing, overestimating the probability of something bad happening, leads us to feel a lot of physiological sensations that are unpleasant in our body. And then because that's also so uncomfortable, and especially as moms, we feel so urgent to kind of get rid of those sensations, we do some type of compulsion. And
Mm.
that's really the second piece of OCD. And I would argue the biggest driving force in OCD is really the compulsions. So compulsions are going to be pretty much anything that you do that is intended to negate or neutralize the anxiety that you feel as the result of an obsession. So compulsions can be overt and behavioral. So it can be, um, I got to go and check my baby. I had this image that what if he fell or what if he had a wound on his head? I have to go and physically check him. Could be seeking reassurance from a partner. I just want to make sure that that you did this the right way, or did he hit his head when he did that? Um, it could also be mental. It could be just replaying something in your head again and again and again. It could be um, rumination, which is kind of this just general term for mentally engaging with a thought, trying to figure something out, trying to overanalyze something. And really, anything can be a compulsion. It's as long as you're trying to do it with the intention of reducing or negating the anxiety that you feel from an obsession,
Mhm.
could be compulsive. What's problematic is that usually works. Those compulsions usually work very temporarily, very reliably, but they're only like a band-aid. They're actually not just a band-aid. They in fact temporarily relieve the anxiety, but they actually make it worse for next time.
Mhm.
So let's say that a mom had an obsessive thought or an image that, oh my gosh, what if my son, fell out of the bed and he broke his arm without any, real evidence that that happened. She might go and run and check on her baby. That would be the compulsion to go and check to alleviate the anxiety from that obsession. And she would feel that temporary relief, right? Like, phew, good thing he didn't fall
Mhm.
out of the bed.
Mhm.
Now, where it becomes problematic is by checking, by doing that compulsion, consciously or not, you've just told your brain, good thing you checked, because otherwise, had you not checked, something bad would have happened.
Hmm.
And that's why it just negatively reinforces it. It just makes it a million times worse for next time. So
Mhm.
what you see is that it's not just like a sprinkling here, a sprinkling there. It really can get out of control, to the extent that women, and dads too, I mean, anyone is really vulnerable to this. It can really spiral. It can become like a wildfire, and it can become really, really difficult to kind of disentangle from.
Wow. Okay. Where to even start with that? I want to go back a minute. When you mentioned something, you said, you were in the field for 10 years or so before you were, I think you said something like struck by it. Like
Mhm.
how does someone, I'm using air quotes right now, but like how does someone get this? Like where does it come from?
Yeah, that's such a good question. So there's a lot of research out there to suggest that it's a nature and nurture situation. So
Okay.
it really does. It runs in families. So we know that
Mm.
based off of research that we've done, that if you have OCD and if it runs in the family, there's this underlying kind of predisposition
Okay.
for you to develop it. Now that doesn't mean that if you have OCD, then your children are 100% going to get it. We find that it's really just a vulnerability type of situation, and certain life events or an event can really trigger that, can really kind of switch the light switch on, so to speak.
Mm-hmm.
And so we know that from twin studies, for instance, some twins develop it and some don't. They're in different environments. So it really does come down to both. Um, but when I say that it kind of strikes, a lot of the reports from people who have OCD and who've been diagnosed with it, it's not always the case, but they say that it kind of like it kind of came to them in the form of almost a slap in the face.
Wow.
That maybe they were always an anxious person, that maybe
Mm-hmm.
they had some more generalized anxiety disorder characteristics their whole life, but then all of a sudden this intrusive thought just slapped them out of nowhere. And
Yeah.
a lot of people with OCD, again, not everybody, and it's not a requirement by any means, but a lot of individuals will be able to tell you like the first intrusive thought that they had. For me, it was about 3 weeks after I had my son, and we were putting socks on him. He was super teeny tiny, obviously. And I remember I went to go and try to put his sock on, and I had the intrusive thought again, just came in like a flash, like a slap in the face, and hit me all at once that I was going to snap his ankles. Whether that was on accident or on purpose, it didn't really matter to me.
Mm-hmm.
I just felt that, and I had that thought, I had that image, and I don't think I put socks on my son for the first year of his life,
Wow.
because it was like, nope,
Yeah.
no, 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 no. Like, and I knew as an OCD therapist, I knew like, whoa, that was an intrusive thought.
Wow.
And I still knew like I didn't have to interpret that as being significant. I didn't have to ritualize over that,
Mm-hmm.
but I did. The stakes were just too high. Like,
Mm-hmm.
no, heck no, was what my
Yeah.
brain said. Heck no. I told my husband, and I made my husband put socks on him for the first year of his life.
Wow. So how do we decipher between the type of intrusive thought that you're talking about and like so when I think I've had experience with intrusive thoughts as it relates to depression, and I have experience for myself with that, but also my experience with that term has more so come to me through conversations of depression, anxiety. So where's the difference? Is it that compulsion piece? It's like the having to act upon something piece?
Yeah, so there's a lot of push to actually maybe even talk about removing this concept of quote unquote intrusive thoughts from OCD language in the first place, just because, like you're mentioning, like I've mentioned, intrusive thoughts aren't the problem. Everyone has intrusive thoughts.
Int-
It's
uh
more so about the misinterpretation of those, and somehow that
ah
we're responsible for them, that they are bad or perverted or disgusting
yes.
or scary, that there's this sense of urgency that they need to fix it right away. They People with OCD often try to control their thoughts. They don't want any bad in. They want to only have the good content
Mm,
in there.
mm-hmm.
Um, and then yeah, obviously followed by the compulsions and just the the repetitive nature of it, right?
I see.
So when it comes to diagnostic criteria for obsessive compulsive disorder, we need to make sure, is there distress and impairment? So distress, how much does this interfere with your daily life? Like, how much
Mm-hmm.
is this problem affecting you? I'm at the point now where I have intrusive thoughts and I definitely give into them from time to time, but it no longer really distresses me.
Mm-hmm.
I'm kind of at peace with it, and I am at the point where I don't let it interfere with my life anymore. Um, and we wonder, to what extent is it impairing your activities of daily living? Is it impairing with your sleep? Is it impacting your relationships? Is it
Mm-hmm.
impacting your ability to take care of yourself or take care of your baby? And then we also generally, for OCD, I say generally because we want to look at the whole picture, but generally, as far as the diagnostic criteria goes, we ask, do you spend at least an hour each day engaging in obsessions and compulsions? And
Hmm.
so those are the kind of diagnostic criteria that would decipher, whether someone is more along the lines of obsessive compulsive disorder, or maybe they're just kind of experiencing these characteristics on a more uh, non-clinical kind of experience, if that makes
Okay.
sense.
Mm-hmm. Mm-hmm. And with that in mind, you gave your own example. Can you give a few more practical examples of how this might manifest from something more extreme to maybe examples that might be right now easily ignoring?
Yeah, absolutely. So when we talk about OCD in general, and it definitely applies to parenting too, to postpartum as well, we
Mm-hmm.
often see a lot of little subtypes, is what we call them. So subtypes of OCD, and they all exist and can certainly exist in postpartum, for moms or for dads or for any kind of caregiver, really. Um, so with OCD, we often see, contamination. So in the postpartum world, that might look like, only wanting to feed your baby all organic stuff. Like, and again, if that's your preference, that's great. But if it's coming from a place of fear, like, oh my gosh, they're going to be contaminated somehow by ingredients,
Mm.
and I have a lot of fear and anxiety around it, so on and so forth. Um, I've worked with so many parents who are terrified of like having their baby on the floor or touching anything on the floor or
Mm.
toys dropping on the floor, just really fearful that they're going to get sick or fearful that they're going to kind of be dirty or tainted. And any examples that I'm giving are just kind of off the cuff. This
Yeah.
can exist. OCD can latch on to anything. OCD can come out in a ton of different ways. So these subtypes are by no means like an all-inclusive list of experiences. If you
Mm-hmm.
feel like you have OCD and it doesn't fall into one of these categories or doesn't fit exactly with one of these examples, still reach out. I mean, there's no shortage of examples out there that this could kind of latch onto. But
Yeah.
um, there's also another subtype that's commonly experienced of scrupulosity OCD, a lot about morality and heaven and hell and all of that. I remember, I'm not even a religious person, so this kind of caught me off guard. But the intrusive thought that really prompted me to get into therapy myself was, I remember I was eating dinner with my son, and he was super happy, no issues. And he was in the high chair, and I remember looking at him and having the intrusive thought, like, you were sent to me by the devil, weren't you?
Wow.
And I was like, whoa, that's dark.
Yeah.
That's dark.
Yeah.
And like,
Mm.
it was awful. It was
Yeah.
just this awful, awful feeling. And in OCD, truly, I mean, logically that doesn't make sense, but you're like,
Mm-hmm.
but what if?
Mm.
But what if? Because you just want to know. It's called the doubting disorder or the doubting disease for that reason. Like, I'm 99% sure that you weren't sent to me by the devil. That's completely ridiculous, and it sounds crazy. But what if you were? And
Mm.
it's wild.
Wow.
Um, Other things, I mean, just perfectionism, right? Like,
Mm-hmm.
wanting to do everything perfect. And I think this is something that moms generally struggle with just in
Mm-hmm.
society, right? Like wanting to generally do well by our children. But of course, it comes down to, is there the presence of compulsions? Is it distressing? Is it impairing your life?
Mm-hmm.
Um, Other ways that it can come out, harm intrusive thoughts, like I've talked about, whether that's accidental or on purpose, harming your child. And again, it doesn't have to be accidental. I've worked with plenty of people who have a hard time cutting up vegetables, have a hard time with knives or with scissors, and they get rid of all the sharp objects in their house
Mm.
because they're terrified that they're going to like lose control and harm their babies.
Wow.
And again, these are individuals who are the least likely to do that. Like I would trust my baby, I would trust my toddler with someone who has harm intrusive thoughts and OCD about that than a random stranger, because the person who has true and tried OCD harm intrusive thoughts is going to be absolutely terrified of that and is going to probably be like overly monitoring them to make
Yeah.
sure. They're probably going to wrap my baby in like bubble wrap
Right.
to make sure that they don't get hurt, right?
Yeah.
So um and then a really taboo one that I really I we don't like talking about, but we need to talk about because it happens, is sexual intrusive thoughts. So
Mm.
in OCD, it's really taboo, but also widely experienced to have sexual intrusive thoughts. So again, these are intrusive thoughts that are coming kind of out of their control, that are ego dystonic. They're inconsistent with their values. They're experienced as very distressing. They're experienced as very much unwanted. But it's very common sometimes for people, especially with OCD, to experience and to report sexual intrusive thoughts. I cannot tell you how many people I've worked with who are terrified of playgrounds, who are terrified of schools, because they're terrified that if they walk by a child, they'll look at them a little bit too long and, oh my gosh, what does that mean about me?
Wow.
What does that mean about me? I must be such a horrible person if I looked at them that way. What does that mean about me? And same with the harm intrusive thoughts, right? Like these are the people who are the least likely to do that. They're so distressed by those thoughts, but they misinterpret those thoughts as being significant somehow.
Wow. So, okay, once again, so much there I want to go back to. So, just to clarify this last piece, since, I think it's of note that it's not talked about and you're making a point to bring it up. Are we mainly talking about sexual intrusive thoughts? You talked about it in relation to children. Is that the main avenue, or is it any sort of like I just don't even want to go to a swimming pool kind of thing?
It could be anything.
It
It
could be
could be,
anything.
I mean, yeah, it really could be anything. These subtypes like sexual or contamination or perfectionism are kind of like little cliques, but things
Mm-hmm.
exist outside of that clique too, right? So,
Yeah.
I've worked with plenty of people who have sexual intrusive thoughts about animals. Again, like they're terrified of animals. It's an exposure for them to look at a picture of a dog, right? Or like I've seen someone break down and crying over petting my dog, like
Wow.
terrified and shaking, trying to
Oh,
pet my dog for an exposure.
yeah.
Um, could
The
have
other
sexual, yeah, go
the
ahead.
other thing that's really I'm just hearing, I wrote it in big letters on my notebook here. The one thing that just keeps coming to me is, I mean, the level of judgment that must go on not only in someone's own head about themselves, but I was even thinking about it when you're talking about the mom who's, terrified of her kid picking something up off the ground. I feel like even just as a society, you're at the library with a group of kids. It's like if the kid throws his water bottle on the floor, I feel like at least me, I kind of get that sense like, oh, I have to look around and make sure people see me wipe it off. Or, I don't know. They just feel like the level of judgment and misconception and misunderstanding about everything that you're talking about must be such a weight in itself for anyone going through this.
100%. And that leads us to so many of the issues with the mental health system, especially for moms, right? Like
Mm-hmm.
our mental health system, and I could literally go on a tangent. So I have to tell myself not to go on a tangent unless you want me to go on a tangent, at which point we will tangent it out. But
Yeah.
like, I mean, our generally OBGYNs are wonderful, and there are some great exceptions. Primary care physicians, wonderful. There are probably some exceptions to what I'm going to say. But for the most part, no one knows about OCD. No one
Right.
knows about, especially these more taboo topics,
Right.
because we don't talk about it. And we don't
Right.
talk about it because no one knows about it. So we don't talk about it. And so, so many women and men and whatever experience these, have these experiences, and they never think it could possibly be obsessive compulsive disorder, because obsessive compulsive disorder is that disorder where you wash your hands a lot, or
I was
where
literally just thinking that exact thing. Like in my teens and 20s, to me, this was the kid in the class that you would just see who had to wash their hands for 2 minutes at a time every hour, or just had to walk up the stairs a certain way, or walk up them twice, or things like that. I mean, I think that has to be one of the biggest misconceptions about what this is about. And I'm so grateful that you're bringing it to moms and bringing it to the mental health system, because I mean, so much of what you're saying is, I mean, I feel like most new moms are going to experience this to some level, one way or the other. I mean,
they absolutely will. And the reason why is because anxiety is functional. And so OCD and anxiety, there's a lot of overlap, and that's another podcast I could go on and on about. But anyway, anxiety is functional. If we didn't have anxiety, we would all be dead, and our children would be dead. So anxiety and OCD love three things. And this is why moms get struck by it so much. And I say moms, but I mean any caregiver, dads too.
Right.
So anxiety and OCD really prey on three qualities. Anything that's uncertain. So I mentioned earlier that OCD is all about doubt, right? It's called the doubt disorder, doubt. What's more uncertain in this entire world than having a baby? And having a child.
Nothing. Yeah, nothing.
There's nothing in this world that's more of a walking, talking, mechanism to display what uncertainty represents, right? That's a child, a baby, a baby in your belly, right? It's all uncertain. It's all uncertain. It's the ultimate case of surrender. The second quality that OCD and anxiety preys on is responsibility. So again, what else in this world are we more responsible for than our children, right? Especially new moms with all of our hormones going crazy, we're hyper responsible, and we need to be. If we weren't, thinking years and years and years ago, evolutionarily, if we didn't feel that heightened sense of responsibility, our babies probably wouldn't make it, right? Survival of the fittest. And then anything else, the other quality that OCD really preys on is vulnerability. There's actually a term in OCD world called the Arnold Schwarzenegger effect, which is to say that no one has intrusive thoughts about harming Arnold Schwarzenegger, right? No one has harm or sexual intrusive thoughts about Arnold Schwarzenegger, because OCD only ever targets vulnerable individuals or vulnerable things. What's more vulnerable and uncertain, and something that you're more responsible for than your child? It's the perfect melting pot for a parent to absolutely lose their minds. And not to mention, other things that are closely associated with exacerbations and mental health problems, and especially OCD, hormone changes. That's a huge issue for moms. Big life transitions, not to mention just having a baby in and of itself is a huge stressor, right? Identity shifts, financial stress. It's a nightmare for moms. And so with that said, yes, absolutely. New moms are experiencing this. All the statistics that are out there are complete crap. If you ask me, 2% of moms say they experience OCD. 1% of women will experience intrusive thoughts. No, if you ask women in a way that they're anonymous and they won't be judged, and they know that they won't be reported to the police for having these thoughts, and if they actually know what OCD is, I guarantee it would be close to 95 or 100%.
Yeah, I mean, those figures are outrageous. I'm thinking of even myself. There's no way that I didn't experience just about everything you're talking about to some level. But at the time, I wasn't in therapy. I wasn't reporting it to anyone. So, hi, I'm example A of someone who's not counted in those statistics. So,
hi. I mean, think about it, when you go and you are in your 6-week appointment, which is absolutely bonkers. It's basically just to make sure that you can have sex again. Um, I mean, you're literally given, I don't know your experience or the general women's experience, but like I was given uh, a very face valid, what that means is it's very obvious what they're asking, measure about depression.
Oh, it's ridiculous.
They're measuring depression. They're not even measuring, which is great.
And
Continue to
really,
do
and
that.
if you don't mind, I have thought a lot about this, so I'm going to cut you off for a second. But they're measuring depression, but really what I feel is they're actually measuring depression only if you're to the point where you might harm your child.
Yep.
They really just care about that extreme place of postpartum depression where you might harm yourself or your child. Anything else in between, no one really has time for on the OB side.
And
it
it's not
seems.
even, we don't have time for it. It's that's normal. Welcome to motherhood. Yeah.
Mm-hmm.
I remember and this is another reason that drives me so much to do what I do and is like the voice of passion behind me right now. Again, I was a well-respected therapist in the area. My OBGYN knew my background. She knew that I knew what I was talking about when it came to OCD and anxiety. She knew that I presented myself well and I knew about mental health. I knew about mental health.
Mm-hmm.
I went to her in tears. I went to her just hysterical. Like, I'm losing my mind. I can't do this anymore. I feel hopeless. Like, I need to get on medications. I need therapists in my area who can help me. Like, I hate my life. And she told me to give my son a pacifier.
What?
Yeah.
What does one have to do with the other?
She told me to give him a pacifier.
Oh,
and that's when I looked at her and I said, I cry in my shower every single day and I ran into traffic the other day.
My God. Oh my goodness.
Like, why do I have to tell you that before you take me seriously?
Right.
And I'm like, what about other moms?
And you're trained. Right. You're professionally trained.
And I'm bold, right? Like,
right.
I was ready to jump over the table and just.
Right.
I
see that as an issue too.
And it's not their fault. Like, they trust their doctor. They trust their doctor. What would I have done in an alternate universe? I would have been like, okay, I guess this is my life now. And I would have walked out of that hospital and I would have probably run away or done something really terrible to myself, to be honest.
Yeah. I mean, I'm right there with you. I completely agree. I have said this before that I think that the very least, aside from a postpartum visit, to check, like you said, if we're okay to have sex again. I mean, why isn't an appointment with a therapist at 6 weeks or at whatever part of our system? I mean, so I do kind of want you to go on that tangent. What do we do about it?
Oh my gosh. I think it's so cyclical, right? Like, I think we don't talk about it as women because we're not given the impression from our doctors that it's important. And I think doctors don't realize how important it is because we don't talk about it, right? Like, I don't know what came first. I don't know the chicken or the egg. I don't know. I don't know.
Yeah.
I know that we have so much room to grow. And like, I know what the solutions would be. I know I would love it if we need to be screening everybody for postpartum anxiety and postpartum OCD and trauma. Like,
yes.
Why just depression? I mean, that's great. I'm so glad that we're screening for depression. Right. But there are other issues too that are even more common and more debilitating than that. So we need better measures. We need, I don't know, like I would say therapists, like coming to check on you in the hospital, right? Like being there the same way that I have I don't know. I had so many other specialists for my physical body. Why don't we have a specialist there to check in on us for our mental health?
Yeah. Is it just that we have never done it before, so it's not done? Like, what do you think about that? Why isn't it done? Do we not have the capacity? Like, I don't know. Like, why? I'm like, I'm getting mad now. Like, why?
I do think that one of the biggest deterrents is just this lack of knowledge, right? That
Yeah.
like, oh, I have thoughts about harming my child. Okay,
Mm-hmm.
well, we need to call the police on you, right?
Mm-hmm.
Like never knowing that that could possibly be anything else, right? Like
Yeah.
I've worked with so many women who have the clear as day OCD, but they have had a history of like having the cops called on them by their primary care physician because they've reported having thoughts of hurting their baby. And it's not that they have wanted to hurt their baby. They're terrified of hurting their baby.
Mm. Yeah, so
They
it's
just didn't
really
know where else to go.
the call from the primary care physician should not be to an authority necessarily. It should be to a therapist or a
Yeah.
psychiatrist.
And I think I would love it if we were all more educated about OCD, right? And so we didn't just have this expectation that it was only contamination or that it was only perfectionistic tendencies. Like, I think even just starting there, that intrusive thoughts are a thing. And this is how you determine whether someone actually wants to harm themselves or their baby versus someone who's having intrusive thoughts and does not want to do that. I
Yeah.
think just more education about OCD in general, especially as someone who goes into this field of working with this population, they need to know that.
Mm-hmm.
I think there's no excuse for OBGYNs, for primary care physicians who are seeing moms to not know that information.
Yeah.
Because like you said, they're experiencing it.
And I could see an OB maybe listening to this and going, you know, I'm trained on so many things, that's not one of them. And so my brain goes to the same way you would have a school counselor, you have a therapist part of your practice then, because there has to be a solution. If we're not going to be able to, and I don't even know the speech here, I don't have enough knowledge on it to speak about this in absolutes, but if we're going to say that it's not fair or not right or not reasonable to require the OB to know what to do in that situation and to handle it, then we have to put someone in place in the office who does.
Mm-hmm.
Because there are two different things, right? But it just doesn't seem right or reasonable or fair for the next phone call to be a police officer who probably doesn't know what to do either.
Oh yeah, for sure.
It's a mess.
Yeah. And I mean, I think we're doing our part. Like these are things that help me sleep better at night, knowing that like if we can arm the parents themselves or the caregivers themselves or just the population, the people who are going into the doctor's offices,
Mm-hmm. Mm-hmm.
And being able to like educate and advocate for themselves, right? Like I've told so many women during podcasts, you're going to have to advocate for yourself.
Yeah.
Like if you are at the point where you are struggling and you are going to bring this up to your physician or your OBGYN or whatever, be ready to advocate for yourself. And that's nothing wrong with you. That's nothing wrong with you. You're not actually that one who actually does want to hurt their baby. You're not crazy. You're not sick enough. You're not whatever. Like it's just it's a problem with the system. It's not a problem with you. And so like I hope that everyone would have been able to do what I did in that situation, which is no, I am not, that's not a good enough answer for me. This is what I'm struggling with and I need your help right now. So
can you talk a little bit about that and in advocating for yourself? Do you have any advice or any general practices for someone who is listening to this and maybe thinking that they're terrified? Like how, just maybe advice on how to best advocate for themselves in that situation?
Absolutely. So I would definitely, especially if you're struggling with harm intrusive thoughts or sexual intrusive thoughts or things that otherwise you're worried that maybe you would be judged for, or maybe that your primary care doctor or your OBGYN would otherwise, worry about you, so to speak, right? So call the cops or whatever. If they're going down that alley, you can advocate and use the word ego dystonic. Okay. Say, I read about this. I know that these thoughts are ego dystonic. this is not something that I want to be doing. These thoughts, these images actually cause me a lot of anxiety. I do not want to do these things the way that a pedophile would, or a killer would, or a rapist would. Like, I do not want that. I do not want that. These are intrusive. I cannot help these things coming into my head. And I don't like
They
that.
scare me because they don't align with me, not because I'm fearful I'm going to act upon them.
They are scary to me because they're scary to me because they're not consistent with my values.
Right.
And if they were ego syntonic, I would like the thoughts. I would want the thoughts. I might even call the thoughts on because they made me feel good. I might fantasize about the thoughts and think about it more versus like, oh my gosh, I don't want to think about that. Why am I thinking about that? That's so terrible. I don't want to think about that.
That's such a major distinction that I just want to take a moment and pause on. And because, again, I'm going to say it again. I think this is one of the biggest misconceptions about everything you're saying is that women are in such a vulnerable place. And to think that we don't have thoughts that scare us. I mean, especially like you said, uncertainty, responsibility, vulnerability. I mean, it's just the perfect storm. And to think that there are women out there, myself included, I don't even know why I'm not including myself in that, but that can't trust that they'll be heard for who they are and what they are is pretty terrifying.
And they may not be. Like, I wish I could say that that's getting better, and I wish I could say that they're going to be met with open arms and a loving, professional support system, but they might not. Yeah. And I think it's better to just like not hold your breath and arm yourself with the education, arm yourself with the advocating ability and confidence of being able to walk into a room in the event that they aren't supportive, in the event that they are kind of dismissive. Just be ready to go. Like, another great example is if you go in and you are only being given a depression inventory is usually what it's called. And it'll usually say at the top, it'll probably be pretty face valid in that way. Like, so-and-so depressive inventory, so-and-so depression screen.
Right.
And the questions are going to be face valid in that you can tell what it's about. Do you feel sad? Are you having a hard time sleeping? Have you lost interest in your normal activities?
On a scale of 1 to 10.
Yeah. I specifically, I was begging them. Like, I am very certain that what I'm struggling with is OCD. Here are my symptoms. I spend more than an hour. Like, I basically did their work for them. Okay. Like, I'm trying to make it as like simple as possible for them. I'm giving them examples, like answering all their questions before they even ask me. Mm-hmm. And they still give me a depression screen. And I tell them, I'll take this, but I'm not depressed. I'm anxious and I have obsessive compulsive disorder. I need you to give me those versions of this inventory. And because I'm a therapist, I knew that there were other inventories that they could give me because I give them out all the time, right? Other people don't know that.
Right.
Other people would just sit there and take that test and then probably be upset because they don't have depression, or they would score high on it, but still not get their needs met. Right. So ask for it. For it.
Yeah, I remember when my first was born, she essentially didn't sleep at all for the first 8 weeks or whatever it was. And I remember going to my 6-week appointment, and my OB gave me that screening. And I remember being terrified to answer honestly. Mm-hmm. And by the time I got to my second kid, and by the time my son was born, I had been with a therapist for a few months. I was way more informed, way more comfortable with my own feelings and knowing what the solutions were and the strategies and the coping mechanisms, etc. That second time, I answered it way more honestly. And you know what? It didn't matter. Like, neither time did anyone go, I wonder if she's okay? Or if they did, nothing came of it. Like,
Doesn't that just enrage you so much?
It does. Like, it was, to me, it was almost, I don't want to say this flippantly in that I answered both I answered that second survey after my son was born, honestly. I didn't lie. I didn't try to manipulate. But knowing that I already had my therapist in place, I wasn't banking on that survey, right? So I was kind of like, well, this will be interesting. If someone takes the next step with me or they don't. And no one did. And it really in that moment I went, well, this is crap.
And
This
that
whole
is
system is crap.
That's unacceptable, right? Like,
Yes.
and that's why even just changing our screening process would be so much different. Like I don't know. We need a better way of measuring it, right? Because like you said, and this is a commonly experienced phenomenon, right? Like when we know, that's why so much research has to be done anonymously, right? Like where you're not able to be identified, because otherwise it totally messes with the results. When if the receptionist gives me a screen and asks me if I've ever wanted to harm myself or my child, I'm gonna put no.
Right.
Like,
and I meant that. I mean, right. At least for me. Exactly. Yeah. And for me, like I was just going to say, like, I put no and I meant no, but that didn't mean there wasn't another level of needing help. And that's reminding me too of, as you were talking about, what someone can do if they really need to advocate for themselves. I'm wondering if you would suggest maybe bringing someone to the appointment who can sort of, I don't know, if vouch for them or just say, because I'm thinking too, someone's maybe in the newborn phase, maybe on top of everything that we're talking about, they are depressed, their kid's not sleeping, they may not have the bandwidth to do all of the research that unfortunately women need to arm themselves with to simply just go to the doctor and get help. So would you suggest bringing someone else into that process?
Yeah, absolutely. If you feel supported by that person, because the work doesn't end there, unfortunately. I wish I imagine and hope that everyone's experience would be different from mine, but when I went there, I was, like you said, I was at capacity. Like I had nothing left to give. I was at the lowest that I was at ever was. Never imagined myself in this situation, dreading going home, dreading living, dreading doing anything. And all I got was a list of probably 20 different numbers to call for therapists. Like no, and by the way, when I finally did call these places, the most promising wait list was, we can see you in 6 weeks.
Yeah. Yeah.
Like I didn't know if I could make it another day. Like I believe I called on a Sunday. Like I waited a couple of days, and obviously I didn't expect to hear back from someone on Sunday, but I was stunned. Like I can't wait 6 weeks.
Right.
I don't know if I'm going to make it to dinner. Like,
yeah.
It's totally unacceptable. And so having someone there to also like make those phone calls, or like even just be with you to like, again, help with that bandwidth, because it's really terrible. It's just one more thing to kind of make you feel hopeless. Like, okay, I have no energy, and now I have to call all these people.
Right. Yeah. Yeah. I mean, I think that I do wanna, I don't know. I feel like when I figure it out, when you figure it out, what really needs to be done with a plan, like you call me, because I'm going to be your campaign manager in some way, because if my heart, like you said earlier, like my heart breaks for just women who are even 5 years from thinking about even being pregnant. Like they have no idea.
No idea. And that's where I think it coming to them. That's where I think it starts. And that's what, again, what little things that help me sleep better at night is being open about my story, not just on these platforms that reach people more globally, but also just with my friends. Like anytime I have a friend who tells me that she's expecting or pregnant, I'm always like, I don't know. I'm torn. It's like I want to warn you, but I also obviously want to be happy for you.
Right.
And so how much warning do you do? Like, I don't know. Yeah. I remember feeling like Motherhood was like an awful, awful, scary movie. Like there was a surprise end scene that no one told me about, that like people only told me about after I mentioned it first. like it was like as soon as I started to get the guts and the courage to say that I was struggling, only then did everyone else kind of come out of the woodwork and say, "Oh yeah, me too." And
Yeah.
it's like, well, where were you before? I've been suffering in silence for the past year. Like
Yeah.
I wish you would have told me that
Yeah.
before.
I've sort of made a decision for myself that if someone, friend or acquaintance is pregnant, is wanting to get pregnant, is in those early phases and they want to talk to me about it, my sort of disclaimer response will be, do you want me to be honest or do you want me to make you feel good?
Mm-hmm.
Because there is a need for both, right? Sometimes
I
people
think you
just
can
want
do
to,
both, but you gotta
right?
do both. You gotta do both.
Yeah.
You can't like it's doing them a complete. It's contributing to the problem. I
Yeah.
feel like to only say the good, to only say the good. We can't do that, and I think that's honestly where it starts. Like just being individually, us all being more open and taking that leap of faith and jumping and not knowing that we're going to be safe on the other side or that there's going to be a net to catch us, but being open about our own experiences, that we don't love motherhood all the time, that we
Right.
do have scary thoughts, that that you struggle and that you didn't bond with your baby right away.
Right. And
I
it
think
also,
I think it
go
starts
ahead.
there.
Yeah. And it goes back to as well the whole culture and fear of judgment and shame. I think that I know personally women who struggle in motherhood but feel like I can't possibly express discontent or discomfort with this because so many women abstractly out there in the world maybe can't even get pregnant,
Mhm.
and what I always try to say to those women if I'm engaging with them is that your personal experience doesn't take away from theirs. We can all be in our own lanes and have our own experiences because we're going to have them anyway. So we can either be honest about them or keep them tucked away, and that doesn't serve anyone.
And that's so important because I remember feeling that way too. Like, who are you
Mm-hmm.
to feel the way that you feel? I had so many friends like you who couldn't get pregnant or were struggling to get pregnant. And I felt you can, what dawned on me and suddenly was like a hallelujah moment for me was that you can feel two things at the same time,
Yes.
that you can feel grateful for the baby that you have
Mm-hmm.
and also feel mournful for the life that you no longer have.
Oh my God, yes.
You can
Literally, I don't know if
feel
I want to laugh or cry, but it's like,
like you can
yes.
love your baby. You can
Yes.
love your
Oh,
baby and never want to change anything, but also want to change everything at the same time.
oh
Like
my God, yes.
you can feel two things at the same time, and that's okay. Like emotions aren't a totem pole. Like you don't have to. They don't have to compete with each other. You can feel two things at once. Like so, I can have my experience that I didn't love. I didn't connect with my baby right away. I
Mm-hmm.
felt I was extremely overwhelmed during labor. I felt my initial emotion was just like overwhelmed.
Mm-hmm.
And I still love my baby,
Right.
right? Like I I don't know, to women out there, and I know I was there, so I feel it too. If you're out there and you feel kind of invalidated, you're invalidating yourself because well, all these other women can't get pregnant, or I should be grateful. Like you can feel the way that you feel and be grateful. You can feel
Mm-hmm.
the way that you feel and still
Right.
honor their experience. They don't have to compete with each other.
I mean, I feel like that's ultimately at every level what what parenthood is. It's
Yeah.
wanting them so badly to go to sleep and then looking at them in their crib so cute and wanting to hug them. I mean, it's like on every level from extreme emotion and feeling what we're talking about to just it's so cute when he eats chicken fingers, but I want to like scream at the top of my lungs when they get thrown off the high chair. It's
Yeah.
like
It's like, oh my gosh, I want you to go to bed. I want you to go to bed. Oh, I'm so bored now that you're sleeping. Like,
yeah.
it's okay to feel two different things at once, right?
Yeah.
With our job, we feel multiple things about other things, right?
Mm-hmm.
Like, I
Mm-hmm.
like my job and I also like want to go home, right?
Right.
Like,
Right. Right.
it's okay to feel two things at once.
Yeah.
We are not these robots. Like
Right.
society programs us as though we have to be. and that we should play that role, but we're complex, and motherhood isn't the way that it was years ago, where all we have to do is take care of children, right? Like we have to still take care of children, and research supports this, that our demands as mothers are, we have the same amount of childcare demands, and we also work 40 hours a week on top of that. Like it's just impossible.
Yeah, and I feel like I could go on about this for another hour, but I want to make sure that I come back to something that is a vital part of our earlier discussion that we kind of moved away from. Especially someone listening, resonating with what you're saying with OCD. What does treatment look like? What does that process consist of?
So if you have obsessive compulsive disorder, and even if you feel like you have more generalized anxiety, like if it comes down to anxiety being a pervasive issue for you, and especially if it's obsessive compulsive disorder, you are going to need and benefit from something that's called exposure and response prevention, otherwise known as ERP.
Okay.
And what that is it's under the umbrella of CBT, which is cognitive behavioral therapy, which is a fancy way of saying that in this type of therapy, we address and we believe in the impact of thoughts, behaviors, and emotions. So finding a CBT therapist isn't enough, though. Like you do need a true and tried and specializing ERP therapist. You need someone who does exposure and response prevention. ERP is the gold standard treatment for OCD and anxiety, meaning nothing else even holds a candle. Nothing else comes close. It's not like I can do this and not do ERP and get maybe 10% better. Like you need to do exposure and response prevention. ERP is more effective for OCD and anxiety than any other treatment for any other disorder. And so what it consists of is, so like I said in the beginning of the podcast, OCD is really a two-part problem, and with the obsessions and the compulsions. So with ERP, we need it, and we have a two-part solution. We have exposures, and then we have response prevention. Exposures are us working with you to basically do these little exposures are challenging and anxiety provoking situations that would be triggering for you. So example would be if you have fears that you are going to accidentally lash out or on purpose lash out, or accidentally stab your baby, or that you're going to drop them down the stairs, or that you're going to fling them off of the balcony. An exposure might be for you to walk with your baby down the stairs, or to hang out with your baby on a balcony, or to cook with a knife near your baby. Then we have the second part, which is response prevention or ritual prevention. So that's where it's really important for us not to just do these exposures, like to go out on the balcony or to walk down the stairs, but we also need to make sure that we're not engaging in those compulsions or rituals that we normally would do to make ourselves feel better. So we have to do the exposure, and we also have to resist our rituals or resist our compulsions. So we have to walk down the stairs with our baby without bracing ourselves or holding onto the railing super tight, or asking our husband to watch us to make sure that your grip is tight enough. We have to cut vegetables with our baby in the same room without confessing to our husband that we are having these thoughts, without telling yourself the entire time, it's okay, it's not going to happen, you've never done this before, it's not that big of a deal. You have to feed your baby the little puff that fell on the floor without wiping it off first or whatever. You have to do this scary thing without doing the compulsion that you would normally do afterwards. And what that does, there's a couple of reasons why it works so well. And there's a lot of research to determine and suggest that neurotransmitters are kind of involved, and it's very kind of physiological as well. But there are two models that kind of explain why ERP works. One is the habituation model. That just is a fancy way of saying that eventually you do these anxiety provoking things and you get used to it. It's kind of like watching a scary movie one time versus 365 times. The 365th time you watch it, you're probably not going to be as scared anymore because you're kind of bored by it. It's kind of monotonous. So if you keep walking down the stairs, you keep walking down the stairs, you keep walking down the stairs, you basically get used to it. You get used to that feeling and it's not as anxiety provoking anymore. Another model that I love this aspect of it is called inhibitory learning. So I think of it like if you're fearful, okay, let's take the sock example with my son and the socks, right? So I had this intrusive thought, what if you snap his ankles? I did a compulsion by avoiding that and giving it to my husband instead. That negatively reinforced my intrusive thought by saying, good thing, and consciously or not, right? I'm not aware of this, but it's happening on some level. It's the opportunity cost. Good thing you didn't put socks on him because something bad would have happened. You would have snapped his ankles. And so next time I go to put on his socks, I'm going to be even more scared because I have provided my brain with that evidence in the past. Well, Jenna didn't put socks on Eli last time, so that must be threatening. That must be bad. So threat, threat, threat. Now with ERP, what we're going to do is I'm going to put on the sock. Maybe I have those thoughts. Maybe I don't. I'm going to allow those thoughts to come in, but I'm going to be a little worker bee and I'm going to resist my compulsions and I'm going to put that sock on and I'm just going to let myself feel uncomfortable. Not only with habituation am I going to continue to get used to that and get used to it and get used to it. Eventually, by continuing to do it, I'm also going to learn a couple of things. I'm going to learn that, one, I can tolerate it, which I don't give myself the chance of learning by just avoiding it and giving it to my husband. Two, I learned that the probability of me actually snapping his ankles is nowhere near as high as I thought that it would be. Three, I also recognize that putting on his socks is not as catastrophic as I thought. So worst case scenario, maybe I make him a little uncomfortable, or worst case scenario, maybe I scratch him on accident. But it's nowhere near this catastrophic thing that I break his ankle, right? And that's it. You kind of just learn, and your brain basically learns that this thing that you perceived as being threatening is not actually all that threatening.
The brain is pretty fascinating, huh?
Oh my gosh. And your brain really, like, if that's one more message I could give to parents out there, your brain wants to protect you. Your brain has one function, which is to protect you and keep you alive until you have a child. And then your brain wants to protect that child and keep that child alive. And so that's where all this is coming from. Like OCD attaches to what you value. Always, always, always. OCD will always attach itself to what you value most. And so it's no wonder why moms and dads struggle so much, because obviously we love and we value our kids more than anything. And so yeah, I mean, it's super treatable. The exposure and response prevention it sounds maybe a little bit scary, but oh my gosh, it's so great to kind of address the fears head on. And really it's all about, the only way over it is to get through it, is really the whole premise here.
Yeah. Would you ever treat symptoms of this with medication?
Great question. So there are tons of medications that are helpful and that are safe to take even during pregnancy and when you're breastfeeding. So that's not an issue. We definitely, when it comes to anxiety and OCD, we suggest against kind of as needed medications for anxiety, like benzodiazepines. And that is simply because they kind of work as a Band-Aid as well, the same way that a ritual would, or using alcohol or any other substance like that. Temporarily, that's going to make you feel better, but it's going to be one of those things like, oh, good thing you took that because now you feel better. But there are tons of SSRIs out there that are effective. The one thing that I always say about medications, though, is that medications for OCD and anxiety might help you get to the starting line, but it's not going to run the race for you. So it's not one of those situations where you can just take a medication and feel better always for the rest of your life. There will have to be some new learning experiences that take place. It's all about basically replacing those old threat expectations, is what we call them, like those old expectations that something bad is going to happen. We have to replace that with more reasonable expectations and learning. And we only do that by putting ourselves out there in a way that's anxiety provoking at first, but that we ultimately can challenge ourselves with and overcome.
Yeah. I feel like in my case, medication is what has helped me just function at a point where I could do the other work.
Absolutely. And that's what it is. Even for me, I take medications. I know the work. I can do the work on my own. Like
Right.
I've written articles. I've spoken at conferences on this work.
Right.
But it felt like it was all coming underwater. It felt like someone was throwing balls at me, but I couldn't catch them. Like
Yeah.
my arms were cement. It felt like someone was trying to teach me things, but I was underwater. It's like I hear you, but I really can't hear you. And as soon as I started taking medications, it was like, oh, I get it now.
Yeah.
Like
Yeah.
I get it now.
Yeah. My my one example like that is that there was a time where I couldn't even imagine taking my kids outside because the thought of getting dressed was just not happening. I wasn't going to put a bra on. I wasn't going to do any of that. I was just going to exist in my pajamas all day. And my therapist explained to me, she's like, listen, we're going to get you on medication, but I want you to fully understand that once you're on the medication, you might still not want to take your kids outside, but you'll make a decision about it. It'll either be that you're going to go outside without a bra on, or you're just going to get up and put the bra on. And I was like, oh.
And it's so true. It's like, you still have to do the work.
Yeah.
Like, if you want to get better and you want your life to improve, you're going to have to do the work. But it's just going to feel like you have an oxygen tank a little bit.
Yes.
And you don't need it. I mean, there are certainly cases of individuals who, their symptoms aren't as severe and they work super, super hard and they don't need it.
Yeah.
But, I am a big advocate. If you've been trying or it just feels too much and it feels like those things aren't resonating with you, give it a try. There's tons of them that are safe and perfectly effective.
And one more thing I want to ask you about that. Maybe you can share your personal experience or what you suggest and guide your clients to do, but how do you suggest a mom or a woman speak to her partner, her spouse, or her whoever is kind of in this life with her? Because what I'm finding, what I'm getting at is that until you know what we're talking about, until you feel it, it's really hard to understand. And so I'm always asking people how they actually are able to communicate it to the people around them that they need support from in an effective way.
Yeah. And I think it's such a great question because it's something that can clearly overtake the entire household, right? I mean, you can see from my examples, I really easily I just brought my husband into the mix really quickly with that one ritual. And that wasn't the only one, right? Like it affected the entire household, which is obviously not good. Not only do those we call them family accommodations, basically anything that family members do or loved ones do, like my husband taking over sock duty, that was a family accommodation. That is a really big driving force in OCD staying strong and getting stronger and getting worse. And I mean, you can probably see now why, but if you've made the determination that this is something that you want to be more open about and that you want to share with your partner, first of all, I think it's helpful to know, are they going to be supportive or not, right? Like, I think everyone is a little bit different as far as it comes to mental health. Hopefully they're going to be supportive. In which case you can kind of gauge what details to share, what not to share. You can share as much or as little as you want, right? Like it's up to you and it's up to your unique situation. I always encourage people to start, have some resources. The International OCD Foundation has a lot of good kind of generic, basic, but also really palatable and tactful resources for not just kind of newbies to this arena, but also loved ones and family members. Here's what to know about OCD, what to tell someone, what to say to someone who has OCD, what not to say to someone who has OCD. So I think having some of those resources at your fingertips and ready to go will help guide the conversation. But I think it would just be helpful to say, you know what, I listened to this podcast the other day and it really clicked for me, what I've been struggling with. And this is what it is. This is what I think it actually is. And just be just be real. Just be real.
Yeah. I've sent my husband a few episodes of podcasts and been like, here, they say it better than I do. Yeah.
And don't be, I still am 3.5 years later after becoming a mom, I still get so resentful of my husband for just like not understanding my experience. And he
Yeah.
is also a therapist. He's
Wow.
so loving and he's so supportive, and I'm super open with him. Like, he knows everything there is to know, but he's not a mom.
Right.
Like, he will never get it.
Right.
He'll never get it. And I remember specifically feeling that way even more vividly when I was a new mom, right? Like, how is it that the woman, I don't even know her name, but we both have newborns in Panera, how is it that I feel more connected to her than I do my own husband, who I've been with for 10 years? Like,
yes.
how does she relate? How do I relate to her more? How do I feel like she gets me more than him?
Not only how, but I remember being surprisingly disappointed in that feeling.
Yeah, I still am.
Yeah.
I still just want him to understand so bad.
I know. I know.
Yeah,
I've tried to move. I've tried to move from needing him to understand and wanting him to understand to kind of shifting my message and my mentality to somewhat of, I know he's can't. I know he won't be able to understand. So now what is it that I need? Okay, I just need, I don't know if this is fair or not. I haven't worked quite all the way through this yet with my therapy, but I just almost need blind support.
Yeah.
Like, no matter what I say, just understand that you can't understand. So it's almost like I just don't want to be questioned on anything. It's like, just know that you don't know what this feels like, and just blindly support whatever it is I'm saying I'm going through, you know?
Yeah, 100%. Yeah. And that's where I think, you know, the mom world and mom groups in society, it can feel like it's the source of a lot of judgment. And it is, right? We do this to ourselves sometimes as women and as moms. But I also think that if you can find moms who you can be like your unapologetic self around.
Yeah.
I have one or two, and like, I can just be super let it all out there type of thing and say whatever it is that I want. And I know I'm not going to be judged for it. And if you don't have them, message us, message me, like, listen to these podcasts, right? Like, surround yourself either with like friends that you have, hopefully, or, you know, put yourself in positions to try to find those people, or just, you know, find that community, whether it's online or on these podcasts. Just know that you're not alone and you're not crazy. Like, I remember the presiding feeling for all of parenthood, really. It was like, what's wrong with me? What's wrong with me?
Right.
And it's like, wow, if we could eliminate so much additional stress and so much additional discomfort and so much additional mental discord, if we just knew that I feel that way too.
Yeah. Yep. I couldn't agree more. And I think the only thing I want to add to that and maybe just clarify is that you don't need a big posse of people. Like, really, if you want that, great. But you really just need, like you said, potentially one or two people that can just hear you for who you are and, like you said, not judge you, and just you can kind of be, you know, no holds bar.
And even if it's just online, right? Like the Instagram that saved my life was not safe for mom group. They're easily searchable, they're huge now, but it's all anonymous, which again eliminates, like we've talked about in this episode, like so many issues, right? With judgment. As soon as you're anonymous, like all bets are off. Like, you can actually get to the real deal. And so I never knew any of these women. I just saw them on Instagram, but it saved my life. It saved my life so many times, because I was like, holy crap, I'm not crazy. Like, I'm not crazy.
Yeah.
And so, I mean, even if it's stuff like that, I have on my podcast, I have a series called Anonymom, where other moms come on and anonymously they share their stories. They get down to the nitty gritty. I mean, so, like you're saying, you know, you don't need those people. You don't need a posse. Work with what you've got, you know, find those resources, just be resourceful.
Yeah. Well, Jenna, I feel like I could ask you 100 more questions, but I will just ask you if there was anything that you would have asked yourself that I didn't? Anything you want to make sure you get into this episode?
Yeah, I mean, I feel really strongly about the advocacy piece. Like, I wish women could just feel armed and have some like tools to break out, some weapons to break out in the doctor's office if they feel like they've been dismissed or ignored or questioned. So I'm hopeful that women feel bold and confident in being able to say things like, this is ego dystonic,
Yes.
right? Like,
Yes.
you know what you're talking about. You know what you're talking about.
Yeah.
And, you know, definitely get exposure and response prevention treatment. Do not just go to a talk therapist. If you have OCD and anxiety, you can't just benefit from a talk therapist, right? Like, you have to have some element of behavioral change. You, even if it's just stuff that you do on your own, even if it's just taking what you learn on your own from this podcast, from internet resources, there has to be some behavioral change. There has to be some element of you exposing yourself to anxiety provoking situations and trying to reduce or resist these compulsions that you do. Otherwise, it's not going to get better. It might just shift to a different theme. It might just rear its head in some ugly fashion, some other ugly fashion. But my hope is that people out there, if they are struggling, that they get treatment through exposure and response prevention. And that's where I'd love to talk about NoCD, if that's okay with you.
Of course. Yeah, I was just going to say, tell us about your, go ahead. Just tell us about it.
Yeah. So one of the great things about, exposure and response prevention is that, you know, it's easily accessible now with a mobile therapy app called NoCD, which is where I work. So that's just at www.nocd.com. We're also on Instagram at treatmyocd. And so we're available in all 50 states in the United States. We're also available in Australia, the United Kingdom, and Ontario, Canada, with hopefully more to be added to that list. But if you reach out for a free 15-minute phone call with our wonderful care team, they will set you up with a therapist. We're all trained in exposure and response prevention. We work with moms all the time, so we are ready to work with you and help you feel better. We also, if that's not quite up your alley just yet, we have free support groups. So I'm a therapist at NoCD, but I also run and manage the support group program. We offer free support groups, and you do not have to be involved in NoCD therapy or in any therapy to participate in them. So it's a great, wonderful, totally accessible resource and a great way for you to have that solidarity with other people who are struggling like you, to get some more information and maybe get your foot in the door. Like, ask some questions about therapy if you're curious about it. And we also have 2 groups that are specific to moms who have OCD and anxiety. So we have 2 separate groups. I know one is on Thursday night at 8 p.m. Central, but definitely continue to check out the website. Check out the NoCD app. It's free on your phone, and you can get a link for the support groups on your phone. And that will show you our calendar of upcoming groups. They go pretty much every day, multiple times a day. They're free, like I said, no gimmick. You do not have to be involved in therapy in order to benefit. So that's another great resource. I have a podcast as well. So I'm over at the podcast called All the Hard Things. It's all about OCD. It's all about exposure and response prevention. If you're curious a little bit more about some more in-depth context for that. And I'm over on Instagram mostly. I'm over at Jenna.Overbaugh. So between all those resources,
it's amazing.
Hopefully that's helpful. And 2 books that I would love to share.
Sure.
Dropping the Baby and Other Scary Thoughts is a really, really great book. It's kind of like the postpartum OCD book, Dropping the Baby and Other Scary Thoughts. And then another great book is Good Moms Have Scary Thoughts. It's just a really great cartoon-based book with really detailed accounts of intrusive thoughts, and it's really, really awesome and just a total game changer. So.
Well, I will put all of these links in the show notes for everyone. And I think it's really coming through for me how passionate you are and how truly, at the end of the day, your goal, it seems, NoCD's goal is really to help people. I mean, you have so many options and so many ways in for someone who maybe not be ready or can't afford, or all of the obstacles people face. It's really refreshing to see a mental health space offer so many different ways that someone can participate. It's really incredible. Thank you.
Yeah. And we do, I mean, if you're just wanting to know more about OCD in general, we do live webinars, again, totally free. They're all downloadable. They're all recorded on our YouTube page or our Facebook page. So those are every Monday, Tuesday, Wednesday, and Thursday at 7 p.m. Central. We go for about an hour. I go every Monday. So if you want to come back, you're welcome to access that live on our, like I said, our Facebook or our YouTube channel. And again, all of the previous ones are recorded. They're housed there, so you can always go back and rewatch one. But you can come on live too and ask a question.
Cool.
And I'm happy to answer any questions, especially if you say that like you found me from the Sass Says podcast. I'll be sure to ask answer your question. But yeah, like if this is new to you in a eye-opening way, hopefully, I know that can come with a lot of emotions,
Yes.
right? Like
totally. And
really,
thank you for
really
saying that. Yeah, that's
yeah,
important.
like knowing that, I mean, it gives me chills too. It can feel like really relieving, like, oh my gosh, that is what I've been struggling with. Can also feel really, really freaking terrifying.
Yes.
Like you're opening this door and oh my gosh, what am I getting myself into? So yeah, I mean, there's tons of education out there. Yeah, I think we do a great job.
Yeah.
We're really invested and we have work to do. Like you said, like we have work to do in making this a better experience for everyone. So yeah, I don't have all the answers, but these little things, I think they're little steps in the right direction. So Thank you for everything that you do. Thank you guys for listening and let me know if I can do anything else to help.
All right. Well, thank you, Jenna.
You can hear our rage, can't you? Mothers need more support. Simple as that. There seems to be this hot mess of things going on for us postpartum. You've got the medical doctors caring for your physical body and its recovery. Wonderful. You've got the pediatrician caring for the baby. Again, wonderful. But who is looking out for mom's mental health? And, I'm thinking about, like who is looking out for her, but it's also what's being done for her or what's not being done. I mean, this is crazy. And I'm referencing the many points in the conversation where Jenna points out that so many women are afraid to speak up about intrusive and obsessive thoughts or compulsive behaviors because they fear what will be done to them rather than trusting that something will be done for them. Assuming that they're safe to tell their OB and they end up getting the police department in their face. Now, obviously no knock to police officers. Perhaps their presence might be needed in some cases, but where is the therapist? Where is the psychiatrist? It's like, you can hear, I'm just like, my mind is just blown that level of person, that type of person, that specialist is not involved in this process. And yeah, there's just a piece of the puzzle missing here in postpartum care. And that piece of the puzzle, the fact that it's missing, is doing a great disservice to the mother, her child, and the family unit as a whole. And when I hear Jenna explain that OCD preys on doubt, responsibility, and vulnerability, I mean, could there be a more perfect storm for new parenthood? This conversation reminds me of the many areas, particularly when it comes to motherhood, that still need our attention. I remind myself, and I'll remind you. It's easy to forget about the difficult phases of motherhood or phases of life when you're past it. But we have to keep working for the women who haven't yet gotten to those phases. Am I right? Or am I right? Okay, well, I'm fired up now, and I'll see you later. Bye.
Thank you so much for tuning in today. Sass Says is a production of Luann Garrett, Inc. This podcast is meant to be educational and not meant to replace professional therapy or professional medical attention. To learn more about today's show and what's new in my world, head over to sasssays.com. Thanks so much. Talk later.